To order. Welcome to meeting number 37 of the House of Commons Standing Committee on Health. The committee is meeting as requested by 4 members of the committee pursuant to a 106 sub 4 to discuss urgent matters as described in the letter dated Tuesday, May 11th. And I would now invite Ms. Rempel-Garner to speak if she wishes.
Thank you, Chair, and thank you to you and the clerk for getting the meeting together today. So per the letter I sent to the committee, we sent to the committee, I move that the committee hold a meeting to invite the Deputy Minister of Health Canada, the Deputy Minister of Public Safety and Emergency Preparedness, the Deputy Minister of Public Services and Procurement, the President of the Public Health Agency of Canada, the Chief Public Health Officer of Canada, and the Vice President of Logistics and Operations for the Public Health Agency of Canada, and the head of the National Advisory Committee on Immunization to discuss recent COVID-19 developments, including but not limited to the timeline for full vaccination for all Canadians, mixed vaccinations, communication of the Johnson & Johnson vaccine, that the meeting be at least 3 hours in length, that the relevant departments for which officials have been requested be invited and asked to prioritize their attendance, but that the meeting not be delayed if they aren't able to prioritize the attendance at the meeting, that the total time allotted for opening statements be limited to 5 minutes by witnesses for no more than 20 minutes to ensure adequate time for questions to be posed by committee members, and that this meeting be held on or before the end of day on Friday, May 21st, 2021. So I'm moving this motion today just because there's been so many questions that have arisen on many of these issues. I do think it is our role as parliamentarians to ask questions of the government on these matters. I think that our committee has been doing good work in pushing the government to act on some of these matters. And there are many questions I think that Canadians have. So I will also note that just per the committee timeline, we are in a constituency recess next week, or a constituency week, which means that normally our committee would not meet, but there's many outstanding questions that I think are very timely, and that if we're waiting 2 weeks for another meeting, it's problematic. So that's the genesis of this. Chair, you'll note that how we structured the motion this time is to, if the ministers can come, great. If not, we do want to proceed with the meeting next week should this pass, so that we're not in a situation where we were in the past where the meeting did not occur. But certainly we would like the deputy ministers of the aforementioned departments there to be able to answer questions. So, the motion is moved in the spirit of asking technical questions of the government, and to ensure that we are getting answers on some of these very important issues for Canadians. Thank you, Chair.
Thank you, Ms. Rempel-Garner. I see Mr. Kellaway, your hand is up. Go ahead.
Thank you, Mr. Chair. And I'll just take a few moments here and just to talk a little bit on the motion here. I want to start by saying that I'm always happy to hear from those leading the charge when it comes to our COVID-19 response, and especially around vaccine strategy. I think as a standing committee on health, it's incumbent on us really to receive these very important updates from our very capable public servants. However, I do want to raise that once again, we find ourselves meeting today forced by a 106.4 motion, which I understand, and as MP Rempel said, is a useful tool when it comes to pulling together meetings around issues of urgency. And I don't think anyone here is denying the fact that we're in the midst of a global pandemic, and we should be hearing from our officials. To be honest, Mr. Chair, I'm mostly frustrated with the fact that before even asking members to request an update from officials in a collaborative way, the opposition continues to make this what seems to be political and partisan. In order to make it seem as though they're the only ones wanting to hear from the witnesses in the motion. And I want to state, quite frankly, clearly, that this is absolutely not the case. And I really do want to reiterate that we're happy to receive an update from officials on these very important issues. So, Mr. Chair, I take some concern with the fact that we're finding ourselves in a situation where some seem to instill some fear in Canadians around vaccine strategy. And our public health agency, quite frankly, is world renowned. I think we would all agree with that. And we've had some of the leading experts in the world as our public servants, and we need to trust them. COVID-19, and everyone knows this, knows no borders, and it knows no political party. COVID-19 is not a partisan issue. And frankly, Mr. Chair, I know I'm not the only one who's getting a little tired of it being treated as one by some. I think that despite the challenges, quite frankly, Canada has and will continue to carefully manage our vaccine supply chain. And I have full trust in our government's commitment to get the vaccines in the arms of Canadians as soon as possible. So colleagues, we've received another 2 million doses of Moderna and Pfizer, and we're on track to receive more than 20 million vaccines by the end of June. And we've said this before, and I think, again, we would all agree, there needs to be more work that needs to be done. And we won't stop until all Canadians who wish to be vaccinated get their vaccine. But all parliamentarians, in my opinion, also have a responsibility to ensure that constituents and all Canadians know that science and evidence shows that our strategy is working. I want to take my province, for example, in terms of proof that our strategy is working. And while I have the floor, Mr. Chair, I'll just take a brief moment to commend the hard work of the Nova Scotia Public Health on our vaccine rollout. Our provincial dashboard has regular updates on the amount of vaccines administered to date. Yesterday, for example, Nova Scotia announced that the province had administered its 400,000 dose right here in my riding at Cape Breton-Canso. So as of today, close to 520,000 doses of COVID-19 vaccine have been administered. Our province has doubled the number of vaccines in less than a month after celebrating 200,000 doses on April 16th, I believe it was. And this week, Mr. Chair, we'll be receiving over 50,000 doses of the mRNA vaccine. The province has reached the vaccine coverage rates of more than 80% of people aged 60 and older. This means that older Nova Scotians are protected against the spread of COVID-19, which is a key element in the Nova Scotia vaccine plan. Today, the province announced that adults between the ages of 35 and 39 are now eligible to book their appointments. This age demographic, Mr. Chair, accounts for approximately 63,000 Nova Scotians. So clearly, Mr. Chair, our rollout strategy is working. We know that it is the will of the provinces and territories to listen to the advice of NACI to better understand the best course of action for provincial rollout plans. And obviously, all provinces and territories are unique and have unique COVID guidelines and strategies. But I think here in the Atlantic region, we've shown that the federal government its role in supporting provinces in the rollout has been successful. It's been a true collaboration, in fact. As I said before, I think it's important that we listen to officials. I think having the experts and professionals, the scientists here to explain that our campaign is working is a great way to address the fear-mongering and fake news that continues to be spread out through the country by some. And I'm sure I can speak for my colleagues on the government side when I say we welcome the opportunity to ask questions and get real facts on the record. Again, there appears to be little desire to collaborate among some. But Mr. Chair, and with respect to my colleagues here today, here's what I think we could have had. We could have had a collegial discussion on inviting the officials to discuss the topics in the motion. Again, we have no issues with that at all. And I think MP O'Connell was the one who said it at the last 1064 meeting that we need to be working together on this committee. We need to ensure that any fear and hesitancy that Canadians have around vaccines is managed and that they know, all Canadians know, that our world-class public health agency knows the science, knows the facts, and those facts and science can be trusted. And, over the course of many months, I thought we were making some progress. But today, I do have some doubts on that. But just before I wrap up, Mr. Chair, I'll remind the committee that we find the 1064 being put out just before the constituency week. And I think it was Mr. Davies, MP Davies, who raised this before, quite frankly. But constituency weeks are an important part of our parliamentary responsibilities, as is our work in Ottawa, or at least virtual Ottawa for most of us. Now, next week for me was in no way going to be a break, or for my staff. With Nova Scotia and another lockdown, my plan was to check in with my constituents. So I've been reaching out to my office just to see how they're coping. And I have no doubt that everyone here, had a busy week planned ahead. But again, and I want to reiterate, that I have no issue inviting the officials next week. I'm happy to hear from them. Now, here's what we need to improve, in my opinion, as a committee. And it's just my opinion. I would really appreciate if moving forward, we could have some respect for the important work we do in constituency weeks, as well as our work on the Hill, and approach these types of meetings in a collaborative way. Finally, I've gotten to know each one of you, and I know that each one of you on the committee want to achieve collaboration. So I believe that we can do that. Thank you, Mr. Chair.
Thank you, Mr. Kellaway. We go now to Ms. O'Connell. Ms. O'Connell, go ahead, please.
Thank you, Mr. Chair. And I think my colleague, Mr. Kellaway for his intervention. I think to try not to repeat anything that he has said, I will off the top though say absolutely inviting officials is not an issue, certainly for me and I think anybody on the government side, but I won't speak for them on behalf. But I think what's frustrating and what I find frankly insulting as a parliamentarian is the treatment of our colleague, Mr. Davies. The committee, long before even I was on this committee, came to an agreement about the nature of studying for COVID and came to an agreement about sectioning it off, and each party would have a relative section or an area of study of their priority. That agreement has been fulfilled every step of the way. We were getting to Mr. Davies in the NDP area of focus, and the rug is pulled out from under them. And just as a parliamentarian, I'm sure there's going to be testimony that will be, not always favorable for the government. That's the nature of committees. That's democracy. Nothing we're afraid of. It is, hearing good information is good information. But to have, it's like that bond and that agreement amongst committee members. If you can't stand by your word, what do you have? And what's frustrating, and Mr. D'Entremont can laugh all he wants, but what's frustrating is the fact that, oh, he's on the phone. Okay, thanks. What's frustrating is that the fact that this motion, had there been any discussions, or frankly, you don't have to discuss with us, that's completely the committee members' prerogative to move a motion when they deem fit. But by doing a 106.4, force the chair in the middle of our regularly scheduled meetings to cancel the meeting for today, the witnesses that were scheduled to begin on the NDP's portion of the study. Frankly, we had witnesses from Switch Health that were on there that I know is a critically important area of topic for our Quebec members. I'm sure all members, but in particular in Quebec, to I don't believe for 1 second that there was a misunderstanding of when that meeting would have to be scheduled, because it would have had to been scheduled by the chair within 5 days. So that would have meant our regularly scheduled meeting on Friday or on Sunday, which would have meant I don't have a problem working Sundays, but I think it's critically unfair to ask the clerk and the interpreters to come in. And the suggestion I'm sure the Conservatives will make, well, we could have met any time throughout the week. Well, no, because other committees are meeting and we all are restrained by the meeting time. And that's actually, frankly, normal in normal parliamentary times when there are limited rooms, et cetera, and you have to work within the House schedule that we have oftentimes. But to do it this way is incredibly frustrating. We could have spent this entire meeting hearing from witnesses. We could have heard from Switch Health. We could have heard from Dr. Morris, who's a professor on infectious diseases. We could have heard from James Maskelik, I hope I didn't pronounce that name wrong, professor of emergency medicine. We could have heard from the World Animal Protection. We could have heard from Dr. Knight, from associate professor, faculty of law. Like, we actually could have spent this meeting hearing from witnesses on the study that was agreed to. And at the end of that meeting, as is normal committee business, a motion could have been made on the floor to then have a meeting in the next constituency week or by the 17th or whatever date that committee members felt appropriate. But by doing it this way, it has shown to me the absolute disrespect for committee members and that agreed upon study and that schedule. The disrespect of, if the Conservatives aren't interested in the subject matter, they will disrupt the committee business. I don't agree with all of the testimony that Conservative members their witnesses have brought forward, but it is their absolute right to propose those witnesses, to have that area of study. And it is this committee who agreed on this format. And for Conservatives to be obstructionist when it is the NDP's turn to have that study, and for no reason other than to say, we don't care about the witnesses that were scheduled for today. We don't care about that area of study. We want to just do what we want to do. And that, to me, as a parliamentarian, is offensive. I fully support the motion in terms of calling these technical witnesses, as Mr. Kellaway pointed out. He made the case in terms of, let's hear this information. But to do it in this way, to obstruct the NDP from getting to their area of study, I think is just absolutely disrespectful to this committee. And the motion could have been made after we heard from these witnesses. We could have had a fully productive day. If it was such an emergency topic, there is absolutely no reason why we couldn't have heard from witnesses today and gotten that testimony and had a full day of actually doing the committee's work. Instead, this was an obstructionist move simply to try to annoy us, I guess, in a constituency week. But again, I have absolutely no problem meeting. So the only thing the Conservatives achieved with this is breaking their bonds and demonstrating to this committee that it's their way or no way. They don't care about the other areas of subject study. They just want to talk about what they want to talk about. So, we're the minority in this, but I take great offense to the disrespect that I think has been shown here. And if other members are okay putting their subject study aside, that's fine. But I just think it was a day during a pandemic when we actually could have heard testimony on the pandemic, then had a motion on the floor, which would totally have been in order to have the same result, which is a meeting next week. But, if the Conservatives don't like the subject matter, they're uninterested and just want to obstruct the committee from doing its work. And that's what I take great offense to. So happy to have these meetings next week, happy to have officials come, but I am deeply, deeply offended and sorry to Mr. Davies for not being able to actually use this meeting as a productive meeting. So I don't know what the Conservatives thought they were gaining in this, but we'll have the meeting, we'll hear the testimony, look forward to it. They have to live with how they conduct themselves as parliamentarians. Thanks, Mr. Chair.
Thanks, Ms. O'Connell. We're going now to Mr. Davies. Mr. Davies, go ahead, please. Don, you're muted.
Had to happen. The phrase of 2021. Eh? You're muted. Well, it sounds like towards the end of the comments of my colleague Ms. O'Connell, it sounds like we're going to agree to this. So it's frankly, I'm looking forward to having a short meeting where we can just pass the motion and move on. But there's a few things I want to say. One is I haven't heard so many nice things said about me at one meeting in a long time, so I probably shouldn't say a word. But I think what I'm getting from this is that on all sides is that we need a better process for determining our agenda going forward. I think it does speak to the less than optimal functioning of our subcommittee. We do have a subcommittee on agenda. And that is, I think, with great respect, falls under the authority of the chair to call. And I'm going to sort of just put that bug in the chair's ear to maybe use that. All parties are represented on it. And I think that we should be meeting on some sort of regular basis to deal with issues. I appreciate the concern for my study. I think this is today would have been the fourth meeting of the 4 meetings I'm entitled to. But I must state for the record that I don't take any offense at the 106 application, nor would I from any party. It's open to any 4 members of this committee to request a 106 meeting. Frankly, it's open to any 4 Liberals. There's 5 Liberals on this committee that could sign one anytime they want as well. Although I am tired, like I know we all are, and I don't have the resources. I think Luke and I, we're just single members on this committee. We don't have the resources perhaps of the other parties. I have come to believe that I think it's probably good practice for this for this committee to meet every week, even on break weeks, at least until Parliament ends, because we are in a pandemic and we are the health committee. And although, we would like this pandemic to be over and everything to be fixed and cured, it seems that every week there are serious issues that have to be looked at. And I just think it's also important to note that I think we all have to be a little bit more sanguine and sensitive about not finding partisan offense in I think what is just normal parliamentary and committee work. I don't actually see any partisan or aggressive or inappropriate motive in the motion put forward today. I think they're raising really important current issues right now. I was just doing that panel I was saying before I came to committee, and one thing that's very clear right now is that 85% of flights in this country that are operating between provinces, and we have rules on international flights coming to Canada. We effectively have very, very few, if any, within Canada. That's a serious issue. There's a study that came out that showed that there's an average of 17 flights per day in a 2-week period that was just done that shows at least one person who tested positive coming off those flights. And so there is clearly data that is showing that there is transmission of virus interprovincially. And I think that's something that really we need to look at right now. There's no quarantine rules. There are no testing rules interprovincially. And I have a feeling that that's a gap that all members of this committee might want to look at. And I think it's listed in this motion. So, so I think we I think it's a good. I think we're all guilty of this. We're all guilty sometimes of turning the partisan heat up. It's a good message, I think, from Mike and from Jennifer and from all of us to recognize that Canadians are expecting us at this committee to focus on the issues and get the best information that we can and to probe. But having said that, I think we have to also be not so quick to find partisan offense in different perspectives. I mean, it's our job as opposition in the government to expose facts that the government may prefer not to see, to challenge narratives. And let's face it, we all come to this committee as parliamentarians, but we all represent our parties as well. And I don't think there's a person on this committee that hasn't at one point or another taken a partisan line on an issue. And they shouldn't feel embarrassed about that. That's what we do. And that's how our messy democracy works, is that, we hammer away at issues and we challenge and we introduce different issues. Some we want to look at, some we don't. And we don't get consensus on these things. So anyway, I guess I don't want to prattle on. I guess I am prattling on. I just think that I support the motion. I think we should be meeting next week. I do want to say one thing as well. Interrupting meetings, it's a reality in this place. And I want to state this for my Conservative colleagues, I don't view any attempt or disrespect on their part. I don't think that's the motive. I think they're motivated by a legitimate desire to see these issues studied. And that's just what happens. I mean, our committee agenda gets interrupted all the time. Estimates come forward. We have to delay our witnesses. Legislation comes before the committee. We have to delay our agenda. Luke has been waiting for the last 2 meetings of his PMPRB study for months. So, I think we have to, be aware if our colleagues are abusing the process to interfere with the agenda. But I don't sense that happening here. I don't sense that from any of my colleagues on this committee from any party. And so I think it's a good reminder for us to refocus on what's important. recognize we're doing the work. Canadians expect us as the health committee to be working on their part and to be probing and exploring and questioning and challenging. And nobody should feel badly about that. And that's what I think this motion will allow us to do next week. So thanks very much, everybody, for listening. And I'm going to vote in favor of this motion.
Thank you, Mr. Davies. I see no further hands raised. I guess we shall call a question in that case. Do we wish to pass this by unanimous consent? Is there any desire to have a recorded vote?
Sure, why not?
All right. Why not unanimous, or why not recorded?
Well, I just want to make sure that it's clear that this is passing. That's all. So maybe we should have a recorded.
Okay, very well. Mr. Clerk, if you would please conduct the vote.
Ms. O'Connell,
Yes.
Mr. Kellaway,
Yes.
Madam Dillon,
Yes.
Ms. Sidhu,
Yes.
Mr. Van Bynen,
Yes.
Mr. Barlow,
Yes.
Mr. D'Entremont,
We.
Mr. McGuire,
Yes.
Ms. Rempel Garner,
Yes.
Mr. Thériault,
We.
Mr. Davies.
Yes.
Mr. Chair. Unanimous, 11 yeas.
Well, I think that one squeaked in. So thank you, everyone. I think that brings our business to a close. I would advise the committee that I am planning to do a subcommittee meeting following the end of Mr. Davies' portion of the study. And just prior to the PMPRB last two meetings, so that we can plan what we're doing following those meetings. So we'll be able to bring witnesses in should that be our intent. So thank you all. And with that, we are now adjourned.
Thanks, Mr. Chair.
Have a good weekend.
Stay well.